The GHA has lived through an extraordinarily busy time during the lockdown period. The health service has dealt with over 24,000 contacts by members of the public through calls to 111 and 12,000 nursing-related approaches. In addition, they've attended to 15,000 requests for repeat prescriptions. Fabian Picardo has described these as wow numbers and paid tribute to the 1,159 GHA employees whom he described as brave though unassuming professionals.
Thank you sincerely on behalf of the people of Gibraltar. Thank you from the heart of the rock. And this is not just talk. When all this is over, I will put our money where my mouth is, and I will ensure that we always continue to have the investment and resources that we need going forward to continue to enjoy the health services that we need and deserve.
Fabian Picardo announced the government would be providing a detailed oversight of the GHA's COVID fund, which has attracted close on £2 million worth of donations. Rules for the use of this money have been discussed with the opposition and are being published shortly. An effort is underway now to retain the positive elements of the period of lockdown, including the new 111 telephone, which is becoming the backbone of the health service and which has demonstrated to be a significant step change in the triage of service requests. One aspect of it which is not needed for now is the Nightingale Field Hospital. As the rock is unlocked, the facility will be decommissioned little by little, although always retaining the ability to be set up again within a week. Nightingale staff have been redeployed to the new Contact Tracing Bureau, which will lead on the test, trace and isolate policy, linked to the increased testing of the community to the tune of 300 persons per day.
This test, track and isolate system that we've put together will be the eyes and ears of the public health team and will allow close monitoring of how the virus is spreading in our community. Given that information, knowing what's happening in the community, public health will be able to intervene at an early stage if the virus starts to spread out of control. And by isolating those of you who test positive and all your contacts while you were infectious, we stop the onward transmission of the virus.
Test, trace and isolate passes the baton on to the public, whose cooperation will be crucial in order to keep the virus under control. If unsuccessful, a return to lockdown is a very real possibility. Paediatrician Dr. Casaglia said that in the meantime, his unit is keeping track of a new and rare condition related to COVID-19 that is similar to Kawasaki syndrome in children. He said the GHA is ready to cope with this if any cases arise locally. He also revealed that there had been 50 lockdown babies born over the past 2 months, with the Chief Minister quick to predict that those cosy days indoors during the past 8 weeks could very well result in a larger influx of Gibraltarian babies in December, January and February.